Hello everyone, welcome back to our channel. If you're new here, my name is Genesis, and for today's video, I wanted to kind of bring you guys along with me to work so you can see what it's like working as a dental hygienist. For the video, we only recorded just one appointment, which my husband was my patient for that, just so you guys can see what I do or what a typical appointment consists of working as a dental hygienist. But at the end of the video, I'll go ahead and give you more of an overview of what a full day is like working as a dental hygienist. So this is your reminder if you haven't been to the dentist in the last 6 months to make your appointment now. Okay, so guys, stay tuned for the video. Welcome to my workplace. First thing I do when I get into the office, if I'm the first one there, is to turn on all of the lights. Then I'll go into my operatory, turn on my monitors, and log in and check my schedule for the day. First, I gotta thoroughly wash my hands, and can we just take a moment to appreciate the aesthetics of the sink area? Now I start to set up my trays for my patients. For today, I'm just going to do a regular prophy or regular cleaning on my husband. So the tray setup is pretty simple. If I was going to do a deep cleaning, then the tray setup would be a little bit different, where I would include more of the anesthesia or a syringe if the patient needed to be numb for the cleaning. Here I'm just finishing setting up my operatory before I bring out my patient. I personally like to wear the cap just to keep my baby hairs from making me look like a crazy person, but overall it just keeps my hair from getting in the way while I'm working. I'm just putting on some PPE to go bring back my patient from the lobby. Once I bring the patient back, I'll check their temperature, check their blood pressure, and go over their medical history. I also have each patient do a pre-procedural rinse with ozone. Oh, can we just take a moment to appreciate how cute my husband looks while he's doing his rinse? During this time, I'll try and make some small talk with my patients to try and get to know them. Most of the time, we just talk about the weather or what's going on in their lives that week. Here, I'm just getting ready to take some x-rays. I think this is the part most patients hate the most, or maybe it's the quote-unquote poking of the gums, or maybe it's the whole experience. If this is you, I'm really sorry. Let me know in the comments below what your least and most favorite part is about going to the dentist. This is my husband's 6-month checkup, and it's been about over a year since the last time we took some x-rays, so I'm just checking a few to update and make sure there hasn't been any significant changes. I'm only taking about 6 x-rays, but if this was a new patient, I would be taking a full set, which is about a total of 18, and that's just so the dentist can make a proper diagnosis of what's going on in the patient's mouth, especially if this is our first time seeing them. Now that we're done with the x-rays, I have the patient put on the sunglasses to protect their eyes and sit them back to start. During this time, I continue to make small talk or just ask them how they're doing with their home care. We usually take the intraoral photos on new patients or when we see something suspicious we want to keep an eye on. For my husband today, I just took some photos of his areas of recession just so I can keep an eye on them. Now I'm just checking his gums for inflammation and recession. For the cleaning, I like to start with the Cavitron to help remove more of the stain or calculus, but if patients don't like the sounds of the dental office, like the scraping or the high-pitched sound from the equipment, I like to recommend patients bring headphones to listen to music or podcasts, or even just bring earplugs. After the Cavitron, I'll go in with my hand instruments to make sure I get all of that bacteria off the teeth and gum line. It's around this time that I'll message the dentist to let her know I'm ready for an exam. We didn't film this part since we came in on the day the office was closed just so we could film, and much thanks to my dentist for allowing us to come in and use the space on a day off. Lastly, I'll polish, and I'll usually give patients about 2 options for the Profi paste. The options we currently have are raspberry and mint. Which one would you pick? Let me know in the comments. After I finish polishing, I'll floss my patient's teeth just to get rid of that gritty paste. And I'll usually go over any recommendations or OHI after I'm done with the cleaning or while I'm waiting for the dentist to come in and do the exam. I'll try to complete my notes while the dentist is doing the exam, but if I don't have time, I'll try to complete the morning notes before I go on lunch, and the afternoon notes I try to get done at the end of the day before I head home. Well, that's how a typical appointment looks like for me in the office that I'm currently at. Some days, I'll get a mix of all recalls, which is pretty much what you guys just saw. And some days I'll have new patients, which is about a 2-hour appointment where we do the cleaning, the exam, the x-rays, all of our assessments. And some days I'll also have maybe a deep cleaning thrown in there. It can be anywhere between an hour or 90 minutes, depending on what the patient needs for that day. So I do get quite a bit of variety. Everybody's a little bit different. Everybody's mouth is different. Some patients are super nice. Other patients, not so nice. So they just keep me on my toes. And, I've been doing this for about 7 years now, and I still really enjoy it. The only thing about dentistry is that it can be really hard on your body, but that's a topic for another video. If you guys would like me to do maybe like a pros and cons of being a dental hygienist, please leave a comment down below. But overall, that's what a typical day or typical appointment looks like for me. Every office is a little bit different, so the flow might be different than what I showed you guys in a different practice. But overall, I think, it's pretty similar. Well, that's it for this video. If you guys enjoyed it, please don't forget to like and subscribe. Again, I really appreciate your support. Please stay healthy, and I'll see you guys in the next one. Bye.